Welcome to the MHSU Referral Workflow video series. In this video, we will walk through how to review and update your client's problems list in PowerChart. This step is an important part of preparing a referral and should be completed alongside reviewing your client's demographic details and updating their gender identity and pronoun information. Let's begin by reviewing the problems list in your client's chart. When you open the chart, navigate to the Diagnosis and Problems section in the menu. At the top, you'll see any diagnoses being addressed this visit, and for today, we don't see any here. Below is the problems list, which we will focus on, as only providers can document diagnoses. The problems list displays your client's medical history, including all active, historical, and resolved problems. You can choose to view all problems, active problems only, or both active and inactive problems. Let's view all problems to ensure the list is accurate and up to date. Here we can see that your client has anxiety, asthma, and suicide attempt listed. After interviewing your client, you understand that anxiety is still a concern and is correctly marked as active here, so no changes are needed. Asthma has been resolved for some time and is also documented appropriately. The client reports that their suicide attempt occurred a long time ago and is no longer an issue. However, it's still marked as active, so we'll need to update that. To do this, click to highlight the problem and select Modify. Here you can choose the appropriate status with the options being active, canceled, inactive, or resolved. In this case, we will select resolved, as the client shared that the suicide attempt was a one-off incident a long time ago and is no longer a concern. This will move the item to the historical section of the problems list. It's also important to include any relevant context in the comment section. So add your comment, and once done, click OK. You can now see your client's suicide attempt is displayed as resolved, with a paperclip icon indicating a comment is attached. Hover over the icon to view the comment. Your client also shared that they are struggling with insomnia, reporting only 2 to 4 hours of sleep per night. This is clinically relevant and should be added to their problems list. To add a new problem, click Add, and then type insomnia in the yellow search field and press Enter or click the binoculars icon to search. Select the most appropriate option from the list and click OK. Complete relevant fields, including when the problem started and any important context in the information in the comments section. Your client reported that the insomnia started about 2 years ago when she was 50, so you can just enter age 50 here. And in the comments section, you'll add that she reports getting only 2 to 4 hours of sleep per night. Once done, and just confirming that this is an active problem, click OK. The problem will now appear as active in your client's problems list. And again, there's another icon here with the comment that she's only getting 2 to 4 hours of sleep per night. Finally, it's important to note that you can also update your client's problems list through the MHSU clinical profile. To do this, go to Ad Hoc and then select the clinical profile. Navigate to the Problems and Diagnostic History section to review the problems list again. If you've already completed the clinical profile and updated the Problems and Diagnosis section, there is no need to repeat this step as the information will carry through. That concludes our walkthrough on reviewing and updating your client's problems list in PowerChart. If you have any questions or feedback, please contact the Clinical Data Systems team at mhsu.cds@islandhealth.ca. Thank you.